The Employer Coalition view of healthcare reform is multidimensional. And I look at healthcare reform as having three major chapters. The first was, and what's been driving the employer and coalition community sort of frantic, is that it's all about insurance regulation and benefit design regulation. For the first time, the federal government is looking over the shoulders of employers and mandating that certain benefits need to be provided. In looking to the future, there's going to be mandates on employers that they're going to have to provide minimum qualified and essential benefits, or else they will have to pay a penalty for each employee. There will be another mandate that they have to make their health care benefits affordable to individual employees, particularly low-income workers. All of these things mean for the first time that we've got big government looking over our shoulders, and that has been a huge distraction, and none of that has led to cost containment, which was a goal of healthcare reform. In fact, it is led, because of the addition of new benefits that they had to add, additional costs for employers. The more positive side of healthcare reform is that there is a second chapter of health reform that relates to healthcare delivery reform. And there are some elements in delivery reform that weren't in the first year implementation, but that are starting to surface now that I think is worth a second look from the employer community. Things like the development of accountable care organizations, more integrated delivery systems that will be accountable for improving population health at lower costs. That might be a potential solution for individual employees, and coalitions could help organize those ACOs in their local community. There is a CMS Innovation Center, which will be trying to be a catalyst for getting community-wide health delivery reform and payment reform activities off the ground. So for the first time ever, Medicare has an opportunity to join with the private sector payers in developing joint community strategies. That represents, I think, a huge potential that, again, coalition community and employers can take advantage of. There are investments in healthcare reform in comparative effectiveness research, a new institute, which will give us the findings that we need to design and decide on our benefit coverages and how we might model our shared decision-making programs with our consumers. There's new investment in a provider performance measurement, which is, again, a key to our value-based purchasing strategies moving forward. So again, first year has been like, let's tear our hair out. Why is the federal government looking into our benefit administration and our benefit design? But there is this newer chapter in healthcare reform that's unfolding that is really about the most important stuff, and that is driving true healthcare delivery reform that I think we can find some partnerships with the federal government moving forward.